The mental illness known as obsessive-compulsive disorder, OCD, is characterized by unwanted and recurrent thoughts, obsessions, and compulsive actions, compulsions. A person's everyday life might be profoundly impacted by these obsessions and compulsions, which can be distressing and anxiety-inducing. Obsessions are uncomfortable and intrusive urges, ideas, or images that frequently cross a person's mind. They frequently cause severe anxiety or discomfort. Obsessions frequently manifest as anxieties about contamination, safety concerns, a demand for symmetry or accuracy, and taboo or aggressive impulses. Compulsions are recurrent actions or thoughts that an individual feels compelled to carry out in reaction to their obsessions, usually in an effort to lessen the misery these obsessions bring. Compulsions might manifest as washing, checking, counting, or mental compulsiveness.
Megan Fox, who is known for her roles in Jennifer's Body and Transformers, claimed that she underwent counseling both as a child and as an adult to learn how to deal with a severe phobia of germs that caused her to wash her hands so frequently that her knuckles would bleed. Donald Trump has been candid about his struggles with OCD and is arguably the most renowned person with the disorder. He has said that he scrubs his hands and face for hours every day. Additionally, he has admitted that he shies away from shaking hands with people for fear of spreading germs. Because of her OCD, Cameron Diaz has a fear of germs.
It's crucial to remember that while everyone occasionally has intrusive thoughts or performs repeated activities, people with OCD suffer excessive, time-consuming instances of these thoughts and behaviors that interfere with their everyday functioning. OCD is a condition that may be managed, and a number of therapy techniques and drugs can aid in reducing its symptoms. OCD is frequently treated using cognitive behavioral therapy, CBT, particularly a type known as exposure and response prevention, ERP. In order to minimize the anxiety brought on by the obsessions, ERP entails exposing the person to their obsessions progressively while preventing the typical obsessive responses. It's crucial to seek help from a mental health professional if you or someone you know is experiencing symptoms similar to OCD. They are able to make an accurate diagnosis and suggest the best course of action. Based on the needs of the person, they can offer a correct diagnosis and suggest an appropriate treatment strategy.
OCD is a condition that Leonardo DiCaprio says he permitted to get worse so that he could portray Howard Hughes in the movie Aviator. Because of his OCD, Justin Timberlake demands that everything be precisely arranged. Additionally, he restricts what can be kept in his refrigerator. Despite having OCD, pop diva Katy Perry claims to wash her teeth 4 to 6 times per day.
For those who suffer from obsessive-compulsive disorder, OCD, a variety of difficulties and problems might arise. These issues may have an effect on a person's mental health, interpersonal connections, and general quality of life. The following are some possible OCD-related complications. 1. Worry and misery. The OCD-specific obsessions and compulsions can produce significant worry and misery. Anxiety might become more intense as a result of the persistent presence of unwelcome thoughts and the need to follow rituals, which can affect everyday tasks and general functioning. 2. Depression. Many people who have OCD also struggle with depression. Feelings of melancholy, hopelessness, and poor energy may be amplified by the chronic nature of OCD and the disruption it causes in daily life. 3. Disruption of daily life. OCD can seriously hinder a person's capacity to carry out their daily obligations and tasks. It might be challenging to concentrate on work, school, and other important things while you are engaging in time-consuming and exhausting compulsive habits. Four, social isolation. OCD sufferers may distance themselves or avoid social events out of embarrassment or a worry that others won't comprehend their symptoms. This can make them feel lonely and make their mental health problems worse. 5. Relationship strain. OCD-related rituals and behaviors can cause problems in relationships with loved ones, close friends, and romantic partners. Family members may struggle to comprehend the compulsions and may feel helpless or frustrated trying to make accommodations for them. 6. Occupational impairment. OCD may make it more difficult for a person to function well at work or to find and keep a job over time. A decline in productivity and stress at work can result from the need to participate in obsessive behaviors or deal with obsessions.
Howie Mandel is quite forthright about his OCD. He refers to railings as his foe. The legendary soccer player David Beckham has acknowledged his OCD issues, admitting that it requires him to rearrange hotel rooms in order to feel at ease. Actress Penelope Cruz, who starred in Vanilla Sky, reportedly has OCD.
7. Physical health. Some OCD-related compulsive behaviors, including repetitive hand washing or checking, can have negative effects on the body. For instance, repeated examination may result in physical tiredness and frequent cleaning may cause skin irritation or dryness. 8. Financial burden. Individuals and their families may experience financial pressure as a result of the expenditures of receiving treatment, including counseling and drugs.
Obsessive-compulsive disorder, or OCD, a mental health illness in which a person becomes trapped in a cycle of obsessions and compulsions, has been diagnosed in a number of TV personalities, artists, sports, and others. Charlie Sheen demands order in his surroundings. He admitted that he even fixed a stranger's shirt collar in a restaurant due to his OCD. Jennifer Love Hewitt, who starred in Client List, believes her mother is to blame for her OCD as she inherited her OCD from her. Actor Harrison Ford of Star Wars claims that his fear of reptiles and spiders is a contributing factor in his OCD.
9. Risk of substance addiction. Some OCD sufferers may turn to drugs or alcohol as a coping mechanism for their worry and discomfort, which could result in substance addiction problems. Unfavorable self-image. Due to their battles with the condition, people with OCD may come to have unfavorable opinions of themselves and low self-esteem. They could think they are weak or imperfect because of their obsessions and compulsions and feel ashamed of them. Suicidal thoughts. In extreme circumstances, the anxiety and despair brought on by OCD might result in suicidal thoughts or deeds. It's critical for people with OCD to get assistance if they are having such ideas. It's important to remember that while OCD can be difficult to manage, there are effective therapies available, and many people with OCD can significantly improve their symptoms and general well-being with the right support and care.
Filmmaker Woody Allen suffers from OCD, and death is his main object of obsession. Also, according to historians, Michelangelo had OCD.
It is imperative to seek help from a mental health professional if you or someone you know is dealing with OCD.
Please smash the like button now and support us by clicking the subscribe button with the bell notification. Please do share and comment your views to understand you better. Thank you. Cheers.